Welcome to City Hall. I'm Supervisor Scott Wiener, and thank you for coming to this press conference today to show our city's continuing and renewed commitment to HIV/AIDS services and prevention and treatment. And I'm going to turn it over to Mayor Lee to make an announcement. Before I do, I just want to thank Mayor Lee and for appointing our wonderful new colleague, Supervisor Christina Olague, who's here today. Thank you, Mayor Lee, for increasing the size of the LGBT caucus by 50% on the board. So with that said, Mayor Ed Lee.
Good morning, everyone. We have a very serious challenge before us. As I have said in not only the speech that I gave on Sunday, but I've been talking with members of the board, and I really want to thank Supervisor Wiener and Supervisor Campos and Supervisor Olague for coming here and joining me today in this announcement. I said earlier through the year that I've always have to watch out for what is not occurring both at the state level and at the federal level. And one of those challenges has been fiscal, that we're not hearing very good news. And one of those news items that I was fearful of was when that super committee that Congress created to try to come together and make an agreement with all the different parties failed in their objective. Our cities across the country were hurt by that. And one of those programs that we value so much, that our leader Pelosi has been such a stalwart leader in and helping our city, is our AIDS funding, the Ryan White Care Funding. And I want to take this opportunity to thank Leader Pelosi for all of her years of commitment on this. She has showed us the way time and time again how valuable this program has been, how remarkable world-class standards that our public health department and our community service providers have had in creating and sustaining an effort to help our victims of AIDS and HIV in a standard of care that has met no match throughout the whole world here in San Francisco. And because of that, we are announcing and I'm introducing, with the help of our sponsors here today, a $1.8 million supplemental to be introduced to the board today to help fill that gap of what was to have been a federal responsibility that now transferred on to the city of San Francisco. It's important to us to maintain the level of services and to put out there the quality of those services to our, not only our lesbian, gay, and bisexual community, but to all of the community of San Francisco. This is one of the most important programs we've ever had produced in our city, and will continue to be so, and this is a reflection of our commitment. Now, this $1.8 million supplemental will be aimed at making sure the level of services that had been promised already this year will be maintained to the end of the fiscal year, while we figure out what the long-term challenge is for all of us. And we've got to figure that out. We've got to do it together. We've got to bring everybody to the table to figure that out, what we do in the next year. But it's one of those challenges that my staff, working with our budget director and working with all of the different community-based agencies and our public health department, along with the Board of Supervisors, are willing to meet, willing to take on, because it's a program that we know has been effective. It has saved lives. It has increased the quality of life for so many people because of the kind of care that we reflected in it. So it's important to us that we do this, but I do it also, again, as I said earlier, under the context that Leader Pelosi would want us to do no less. And now, when so many of her years where she stepped up to help find those federal funding to save it, it's our turn to step up when our Congress has not been able to meet that task, and we are stepping up. So I want to say thank you to everybody behind me. We have representatives, Dan Bernal's here on behalf of Congresswoman Pelosi, and I've valued his work with us on a local basis. And then all of our community partners who have been with us for many, many years. I want to thank them, too, for their invaluable service to us. Thank you. Scott?
Thank you, Mr. Mayor. And I just want to say that when Supervisor Campos and I went to Mayor Lee to ask him to work with us on this, he did not hesitate and has been absolutely enthusiastic and rock solid in his support. You know, I have the honor of representing District 8, which includes the Castro and surrounding neighborhoods, and my district has been the hardest hit by the HIV/AIDS pandemic and has the highest number of people living with HIV/AIDS. And I see every single day constituents of mine who absolutely depend on these services, whether it's for access to housing, to legal services, to health care, to mental health services. These are not optional services. These are not luxury services. These are basic bedrock services for a significant number of people living in this city. And, you know, over my dead body are we going to retreat from our commitment to the people living with HIV/AIDS and those at risk to HIV/AIDS. And I really just want to emphasize how grateful I am and how grateful we all are to Nancy Pelosi, who went to Congress in 1987 and in her maiden speech on the floor of the House talked about how she was there to fight HIV/AIDS, and she has fought it in an incredibly heroic manner for the last 25 years, and we all owe her an enormous debt of gratitude for her leadership on this issue and for the unending funding that she has brought into San Francisco to allow us to maintain our commitment to those living with and at risk for this disease. So thank you, Leader Pelosi, for standing with us and for continuing to stand with us. I now want to bring up my colleagues, Supervisors David Campos and Supervisor Christina Olague, as well as Dan Bernal speaking on behalf of Leader Pelosi. So Supervisor Campos.
Thank you very much, Supervisor Wiener. And let me echo what Supervisor Wiener said about Leader Pelosi, who to us will always be Speaker Pelosi. But we have been very lucky in San Francisco that we've had representation in Washington, D.C. that has advocated for the HIV community and that has, in so doing, made San Francisco an example for the rest of the country in how to treat that community. And as Scott Wiener indicated, we in San Francisco have a lot to be proud of, and we should not go backwards. And I want to thank Mayor Lee for the fact that when Supervisor Wiener and I went to him, there wasn't any question, no hesitation. And I think that those of us who are members of this LGBT community, we are very grateful to you and want you to know that we appreciate that commitment that you have made. I also want to thank our Director of Public Health, who also was instrumental in making this possible, Barbara Garcia. And I'm very excited that we are joined today by our newly appointed LGBT supervisor, Christina Olague. And I think this is Supervisor Olague's second press conference as a supervisor. And it might be her first co-sponsorship. And I think it's a testament to her commitment to our community that she's here. And I think that it sends a very clear message also about the unity that we have on the Board of Supervisors. We, the LGBT supervisors, understand that we have to make sure that we're united in trying to protect our community. And this funding literally will save lives. It has saved lives. We're talking about protecting the most vulnerable in our community. And so I am proud to be a part of a city government that makes that investment. And again, I want to thank Speaker Pelosi. I want to thank Mayor Lee, Supervisor Wiener, Supervisor Olague, and we look forward to the full board approving this matter expeditiously. And finally, I want to thank the advocacy community, those who are working with people who are living with AIDS, HIV, who brought this to our attention and who pushed for this forward. It couldn't have happened without their support. So thank you very much.
I want to thank Mayor Lee and Supervisors Wiener and Campos for inviting me to participate in this action today. It's my first action as a supervisor, member of the Board of Supervisors, and I'm very proud to be here as part of that, as part of this effort. I have worked extensively with low-income tenants in San Francisco. I've worked with seniors and people living with disabilities. I've seen also folks who are able-bodied have, reach points in their lives where they are no longer able to work due to the devastating impacts of this disease. It's unconscionable that we wouldn't do all that we can to make sure that people who are suffering for the impacts of AIDS still have some ability to access decent quality of life, housing, and health care. So I first moved here in 1982, and that was really at the outbreak, the very beginning of this devastating disease. And I had many friends that I lost as we all have here in San Francisco. Many of my friends I lost in the 80s. I remember one year we were having a Thanksgiving dinner with friends, and it started out with 10 of us at the table. By the year 2000, only 3 of us were left, and it was all due to the impacts of AIDS. So I know that we are all familiar with those losses. So again, I want to thank Supervisors Wiener and Campos for inviting me here. I also want to acknowledge the efforts of the LGBT community and all those CBOs that do work daily delivering services to the community. So again, thank you.
Good morning, and thank you all for being here. My name is Dan Bernal. I'm District Director for Democratic Leader Nancy Pelosi. She could not be here today, but she did ask me to come to share some words and also to express her deep gratitude to Mayor Ed Lee for his continued and outstanding leadership and continued commitment in the fight against HIV and AIDS, and also to Supervisors Wiener, Campos, and Olague for all their work that they're doing as well in this regard, the mayor's fantastic staff, our Director of Public Health, Barbara Garcia. Barbara, where are you? Thank you. So while she couldn't be here today, she did ask me to share some words. Oh, and she also, of course, wanted to express again her deep gratitude to all of the members of the community of HIV/AIDS service providers, some of whom are represented here today, some we've lost in the last few years, but for their ongoing commitment in the fight against HIV/AIDS. So here is Leader Pelosi's statement. The fight against HIV/AIDS and for those suffering from this terrible disease has been one of my top legislative priorities for nearly 25 years. San Francisco was hit early and hit hard by the devastation of HIV/AIDS, but San Franciscans responded by developing a system of care that became the model for the Ryan White Care Act. Our city showed the nation that comprehensive HIV/AIDS care and services work, save lives, and save money by keeping people healthy and productive. Today, again, San Francisco leads the way for compassionate, community-based care for people with HIV/AIDS with this supplemental budget from Mayor Ed Lee. Ryan White-funded initiatives are saving lives. Declines in AIDS deaths are a direct result of the therapies and services that have been made more widely available through the Ryan White Act to large numbers of uninsured and underinsured people living with HIV and AIDS. That's why it was disappointing when the Bush administration first proposed severe cuts in Ryan White investments to several jurisdictions, including San Francisco, and that's why I fought continued Republican efforts to sustain these cuts. For several years, I worked successfully in a bipartisan way to roll back these destabilizing cuts and their potentially devastating impacts. Since 2007, we've restored nearly $21 million to San Francisco's systems of care. Every step of the way in fighting these cuts, I've found a partner in the San Francisco mayor's office. Beginning with Mayor Newsom and continued by Mayor Lee, our city's leadership has been determined to help local care organizations fill the gap. Today's announcement by Mayor Lee of $1.8 million in supplemental city funding will result in saved lives. I'd also like to acknowledge Supervisors Scott Wiener, David Campos, and Christina Olague and members of the San Francisco HIV/AIDS Planning Council for their leadership in this fight. Together, we will uphold the spirit of the Ryan White Care Act, ensuring that HIV/AIDS care, treatment, prevention, and research receive increased funding, and improving and strengthening those investments until HIV/AIDS is a painful chapter in the distant past. Thank you very much.
I now want to welcome up two members of the HIV/AIDS provider community. Brett Andrews, the Vice President of the HIV/AIDS Provider Network and also the Executive Director of the Positive Resource Center, and Laura Thomas, who is the member and former co-chair of the San Francisco HIV Health Services Planning Council and who also serves as the Deputy State Director of the Drug Policy Alliance.
Scott's tall, and I'm short. Good morning, everyone. I'm Brett Andrews, and as Scott said, I am proud to be the Executive Director of Positive Resource Center, but I stand before you here today as a representative of the HIV/AIDS Provider Network. The HIV/AIDS Provider Network is a coalition of over 30 San Francisco-based nonprofits that provide a comprehensive array of services daily to people living with HIV and AIDS. Today is a good day for San Francisco, and let me tell you why. Back in December, when the service provider community found out about this loss of funding of over $4 million, we truly were in a state of shock. But we knew what was at stake. So we quickly got to work, meeting with Barbara Garcia at the Department of Public Health and Supervisors Campos and Wiener and the mayor to figure out what solution we could put to these devastating cuts. And I am pleased to report that all of them were keenly aware. Hold on one second. I'm pleased to report that all of them were keenly aware of these devastating cuts long before we met face to face. So we gather here today to thank and acknowledge Mayor Lee, Supervisor Wiener, Supervisor Campos, Supervisor Olague for their leadership, receptive ear, and nimble response to our request for emergency financial support to help mitigate these devastating cuts. Mayor Lee and the supervisors' joint request for a supplemental appropriation of $1.8 million will help ensure the continuation of vital primary care and supportive services which are essential to the health and well-being of people living with HIV and AIDS. San Francisco has provided leadership to the entire country with an effective model of care to respond to the AIDS crisis. And the leadership that is represented here today and the cooperation is reflected here today, and we rely on it in the coming years. To the remaining board members, when this important piece of legislation reaches your desk, I encourage you not to tarry, but to move forward with swiftness, because the very people whose lives are impacted by it hang in the balance. And while we're pleased and grateful for the result of our collective work today, there is still so much more to do. The community of service providers, DPH, the mayor, the supervisors, all have made a strong commitment to continue to dialogue in an effort to design a strategy to minimize the harm in this loss of funding. In closing, I'd like to thank Congresswoman Nancy Pelosi for her and her office for her unapologetic and strident commitment of HIV issues over the years. Congresswoman Pelosi is passionate and true. My grandmother always said, when people show you who they are, believe them. Leader Pelosi has shown us who she is, and we believe her, and we believe in her, and we thank her for standing in the fight all these years. She indeed is our hero. So for all of us here today, I ask that we remain focused, educated on the issues, and resolved to achieving the outcome of our choosing in making sure that people living with HIV and AIDS are given the necessary services and maintain a good and decent quality of life. Again, thank you for your work in the community, and thank you for your presence here today.
And I'm even shorter. We're going in the right order. I'm Laura Thomas. I'm a member of the San Francisco HIV Health Services Planning Council. We are the federally mandated community planning council that prioritizes and allocates the federal Ryan White funds for 3-county area, including San Francisco, San Mateo, and Marin counties. And one of the things that we've had to do in prioritizing and allocating those funds for the last several years is decide where and how to cut funds that we know are desperately needed by people living with HIV in San Francisco. So with that, I am incredibly grateful and thankful to Mayor Ed Lee, to Supervisors David Campos and Scott Wiener, and Christina Olague from saving us from having to make those very difficult decisions for the next few months. There are more people living with HIV in San Francisco now than there have ever been, and yet we have fewer federal resources for the services that we know are needed than we have it's been going down for the last 15 years. Federal funding is half of what it used to be, despite the best efforts, and they've been amazing, of Leader Pelosi. State funding for HIV services has entirely evaporated, and healthcare reform is at best an unfunded mandate right now. We have to go back to where we were when the epidemic started, when San Francisco set the model for the nation and for the world in stepping up and taking care of people here in San Francisco. We are a city of compassion and justice, and we're willing to use our resources to take care of people here in San Francisco, even when other governments are not living up to their responsibilities. So this is San Francisco stepping up to ensure that people living with HIV continue to get the services and the health care and the treatment that they need. That's perhaps a sign I've gone on too long. We need to continue to invest in HIV prevention, which is also taking a cut this year. There's a sense among people who work in HIV that the end is in sight. The end of this epidemic is in sight for the first time ever. But that will only happen if we continue to fully invest in effective HIV prevention efforts, such as syringe access, and if we ensure that everybody can access HIV treatment and can stay on it and get the full benefit from it. So San Francisco, as we have since the beginning of this epidemic, is showing how to do this, but we need the resources to match our hearts and our brains. We will continue to advocate for the federal funding that's needed. There's work to do, obviously, as Mayor Ed Lee said at the beginning. How do we continue to address this challenge into the next city fiscal year? And from the HIV Health Services Planning Council, we pledge to work with the Mayor's Office, the Board of Supervisors, Leader Pelosi's office, the HIV Aid Provider Network, and the Health Department to do everything we can to ensure that those resources are there, and that as we transition services from one funding stream to another, that it's done as seamlessly as possible. So on behalf of the HIV Health Services Planning Council, I want again to thank Leader Pelosi for everything that she's done, and for the mayor and the members of the Board of Supervisors for stepping up so quickly in this moment of need and ensuring that people living with HIV will continue to get these services. Thank you.
Everyone, thank you for being here today.
Apologize. Our number 1.6